Good afternoon. It is 12 p.m. and we'd like to welcome you to the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. And this is week 32. I'm delighted to be your moderator for today. My name is Yvonne Lewis. I'm the co-director of the Community Core for the Healthy Flint Research Coordinating Center. And as you may recall, we've said on a number of occasions, the Healthy Flint Research Coordinating Center is a multi-institutional partnership led by a strong community core with great academic partners, the Michigan State University, University of Michigan Flint, and the University of Michigan Ann Arbor. For those of you that are joining us today by phone or via YouTube, we want to remind you that you can give us a call at 810-835-2130 or check out our website and send in questions today at info@ Healthy Flint Research Coordinating Center, hfrcc.org. And we will be happy to make sure that if we're not answering your questions today, we'll get them in the queue for future conversations. Just as a reminder, when we started the Healthy Flint Research Coordinating Center's community webinar coronavirus on March 20th, the goal for us and the real intention was to bring a local context to a global pandemic. As a result of all of your input and involvement, we've been able to engage our partners, as you can see, for those of you that are able to see this visually, over 24 community organizations, business, hospitals, federally qualified health clinic, even representatives from the city of Flint, the state health department, Michigan Department of Health and Human Services, and the state of Michigan have joined us. Consumers Energy, the Flint Community Schools, and I could go on to list these partners, but they've come on to be experts in our panel to answer questions for you. So today we have representatives from many of these organizations who are serving as our panelists. We want to invite you to please put your questions in the queue as we're moving forward today so that they in the background can answer them for you. And some of these questions will be moved forward for all of us to hear. Want to be sure that you are aware that today in our webinar, we've got some very important information we're going to share with you. If you have opportunity, text a friend, let them know they can still register and be a part of the webinar. Go on YouTube and join us today. We certainly want to make sure that all of our community members who have opportunity can be apprised of this information today. We have so much information. We're going to get into this webinar really quickly today. We have our health officer, and I've been so excited about this, Dr. Lawrence Reynolds, who is a pediatrician at heart, but he is just an advocate for our community in so many places that many of us cannot be. And as the chief health advisor of the city of Flint, he always brings good information for us. So he's going to kind of frame today for us as we move forward in this webinar. Dr. Reynolds, welcome today.
Well, I thank you. And I'd like to start off in the spirit of the coming holiday, but I'll change it. Don't be tricked and watch how you treat your neighbors. And so when people tell you that this COVID is nothing, they're wrong. It is not over. As my folks used to say from Georgia, if you don't believe fat meat is greasy, you're a fool. So let's pay attention. You must, at this point, all of us should have been tested at least one time and should consider when we'll get tested again. It's important that our community knows exactly where it stands, and that's how you help yourself, your household, and your family, and you help the health departments know what's going to happen next. And then don't be tricked by assuming everything is normal. As we look at the holiday season and all these gatherings that are coming up, be it for sports or for Halloween or for Thanksgiving and Christmas, I'm sorry to lay it on you this way, but you better reconsider how you're going to do this. And the best advice is to restrict it to your household. You can Zoom people, you can call people, but for all these social gatherings, be they celebrations, weddings, funerals, religious observations, think before you act. And remember, ideally, keep these social gatherings down to your household. And as we look across the country, we see where groups of young people are gathering. Earlier this summer, the focus was on the kids in Flint. They're doing this and that. Well, now the colleges are open, and we're finding out that those same type of gatherings are causing problems in the community. You understand that U of M Ann Arbor is on lockdown. This will not be the first and only university that will be on lockdown or closing, because now we understand that these group gatherings can lead to spread throughout the community. So remember, yes, we are our neighbor's keeper. So get tested, wear your mask, wash your hands, if you don't have to go out, don't go out. And we're not doing these things just for ourselves. And if you want to hear more, and if you want to hear directly from our mayor, listen to WFNT 1420 AM, 9 o'clock on Saturday. And if you missed the 9 to 10, you can also, yes, if you missed that 9 to 10, you can also follow up on City of Flint social media page, Facebook. So please, that's every Saturday. So if I say something you don't understand today, you can check me on Saturday. If you want to hear from the mayor, talk to him directly on Saturday. And right now, I'll turn you over to the next best person from the city of Flint.
Dr. Reynolds, if I could just say that it's WFLT.
Oh,
We talked about earlier, back in the day, there is an FNT, but we're FLT, WFLT 1420 AM on Saturday for the mayor. So thank you, Dr. Reynolds. I told you he was going to frame it for us. We all need to be mindful of this. So Billy is the manager of public health at the City Hall. Billy, share with us.
Good morning or good afternoon. I say good morning every week, but good afternoon, everyone. I am Billy Mitchell, Manager of Public Health for the City of Flint. I wanted to talk to you today about voting and also about pipeline replacements. So you are able to get your opt-in form in to me. I'm Billy. By calling me at 237 or 810-237-2044. Or you can also go on our website at www.cityofflint.com and fill out your opt-in form there. You have until November 19th to get it in, to make sure that your pipes are replaced. Once you get your opt-in form in, you'll have to also schedule a time for Lang to come out and check it. So it's not like you just turn it in and that's it. Lang will come to your residence. They'll try 3 attempts to get a hold of you so that you can schedule a time for them to actually check your property to see if your pipes are lead or not. Next slide. Now to voting, absentee ballot voting. You can request an absentee ballot and you can request it on site here at Flint City Hall, and you can turn it in right there, then and there. Your early voting, you can come to the clerk's office, like I said, on site and bring it in. Now, to request your absentee ballot, it's best if you take it to a ballot box instead of trying to mail it in so that you can make sure your ballot gets in on time and your vote gets counted. Voting actually on election day, November 3rd, will take place at your precinct. And if you're not sure which precinct that you're supposed to visit, you can go to www.cityofflint.com. We have all the precincts listed there. Voting is from 7 a.m. to 8 p.m. And also, you can come in to the city clerk's office at 1101 South Saginaw Street, downtown Flint, Michigan, from 8 a.m. to 5 p.m. to do your absentee ballot voting in the clerk's office. And in addition, we'll have office hours on Saturday, October 24th from 9 to 5, and on Saturday and Sunday, October 31st and November 1st from 9 a.m. to 5 p.m. There are ballot boxes located throughout the city for your convenience if you cannot make it to downtown Flint. But again, downtown Flint, we're located at 1101 South Saginaw Street. On the north side of Flint, you can go to Burston Field House. Their address is 3300 North Saginaw Street. On the south side of Flint, we have Word of Life Ministries at 460 West Atherton Road. On the east side, we have Mintz Manor, 3820 Richfield Road, and the ballot box is in the lobby. And on the west side, we have West Court Street Church of God, address 2920 West Court Street. The ballot boxes are brown. Do not get them confused with the red boxes. Do not get them confused with the blue US mail boxes. And if you have any other questions, you can contact the city clerk's office, 810-766-7414.
Thank you so much, Billy. We're glad to know that even though all of these things are going on around us, you're still in place to make sure that we can get this information and to facilitate the supporting the community members in addressing the issues that they have as it relates to your work. So thank you so much. And we've been talking about voting and where we can go to vote. Dr. Deborah Holden is going to share with us a little bit more detail because we've been talking the last couple of weeks about planning your vote. And there's some things that have come forward that Dr. Deborah has really just tweaked in such a way that makes it really easy for us to understand. So Dr. Deborah, take us a little bit deeper into the planning to vote.
Okay, great. Thanks, Yvonne. I want to talk to people about planning your vote and voting your plan. This is a constitutional right, and I want to make sure people have what they need to exercise that right while at the same time staying healthy and safe. So I've come up with a new acronym. We all know what PPE stands for, right? Personal Protective Equipment. Well, I got a new acronym for you. I call it PPE plus C. You need to prepare, plan, execute your plan, and then have a plan C. So let me tell you what the first P, preparation. What does that look like? You need to make sure that you are registered to vote. Online registration for Michigan is now passed. If you are not registered, you can still register, but you cannot do it online. That came and went October 19th, and we've talked about that every week. You can, however, register in person up to the day of voting. If you want to confirm whether or not you're registered, you can go to vote.org. That is a site that has been set up by the Transformative Justice Coalition, headed by former Senator and attorney Barbara Onwine. It's a credible site. You can go there and check. Wonky things have happened. Make sure you haven't been purged from the voter rolls. The other thing I want to tell people is you got to know the ballot. This is the preparation you can do at home. A lot of what we've seen in other cities with the long lines outside is because they're trying to minimize the number of people inside. Why? We got a virus that spreads through the air. So if we've got people inside, the likelihood of people infecting one another is greater. Those long lines outside, in large part, are driven also by the delays inside. So know your ballot. Look up the ballot. Go to the city clerk site. If you haven't already requested an absentee ballot, you can do that, or you can go pick your ballot up in person. I personally voted yesterday downtown. I purposely did not have an absentee ballot because I wanted to test the process for myself so I could credibly tell people it works. The whole thing took me about 5 minutes. But my dear friend and colleague, Yvonne Lewis, sent me a copy of her absentee ballot. I was very aware of what was on. I did my research before I got there. I already had my mind made up. So when I got there, all I had to do was fill out the boxes. So know the ballot. That's prep work you can do at home. So when you get to the poll, your time inside is minimized. Get your day of supplies. I'm going to run through a quick checklist that I think people need to have your day of supplies. Also, on the day of, manage your personal needs. Whatever plan you come up with, when you actually go to vote, don't go to the polls hungry, thirsty, tired, in a bad mood, or all riled up. And we'll talk about that in a second. I've created something else that I call mindful enthusiasm. We like to hoop and holler and scream and shout, and voting begets that. But with a virus that spreads through the air, we want to actually manage that and practice enthusiasm with our eyes and other things. Dress for the weather, just in case you have to be queued up outside. And please, again, good hand hygiene, practice that. Wash your hands before you go, and then take your equipment with you or your supplies to be able to sanitize. There is plenty of sanitation material at the site. All right, so you're prepared. You've done everything that you could possibly do at home. So when you get to the poll, you're ready. Now you got to plan your vote. You need to pick a day and time. And I'm telling everybody, you need a plan A and a plan B. Why? The day that I plan to vote and had my children all queued up, I have a brand new 18-year-old who was fired up, ready to vote. My son was all ready to vote. And that was the day we got the hailstorm. You got to just leave room for contingencies. So pick a day and time, have a plan A and a B, and pick the method that you're going to use. If you're going to vote by absentee ballot, I'm telling everybody it is now officially too late to mail your ballot. Why? I trust our mail, but we've got some wonky things happening. If you put it in the mail and it doesn't get counted, that would be a disaster. So you need to pick the method. Are you going to go vote in person, or are you going to drop your absentee ballot off at one of the ballot boxes? And I really appreciate Billy Mitchell. She's been amazing. Pick the location. Know where the ballot boxes are. Have that prepared. Let's say your plan A is to go and vote down at the clerk's office. You have the absentee ballot. And guess what? Some church group decided to come and bring 200 church members, and you get there and the line is like ridiculously long. No problem. You've got a plan B. You've got the locations for the ballot boxes. Drive that ballot and instead drop it off at a ballot box. Again, November 3rd is your last opportunity to cast your vote. So I'm telling everybody, November 3rd is not a plan. It leaves no room for anything to go wrong. It just doesn't. So if you can, please vote early. Okay, now PPE, execute that voting plan. Go vote. Take other voters only. I, like many of you, loved taking my children, my parents to the voting polls with me. Because we're in a pandemic, that's probably not the best idea right now. What we don't want to do is give others the experience of there's a whole lot of people and their wait is going to be extra long. So if you're going to go, reach out to a neighbor, a church colleague, a family member, a friend. Take other voters with you. If you're going to go en masse, make sure that the people you're going with are other registered voters, and support them. Support them on that first P, that preparation, and the second P, the planning, and go with other voters. Find creative ways. I took a picture. I did a Facebook Live as I was walking out with my voting sticker, encouraged my kids to make sure that they go and do the same thing. Again, practice that mindful enthusiasm. This is not time for us to be hooping and hollering. If you bump into somebody that you know, don't pull your mask down and start having a conversation. You got to stay masked up. You got to be mindful. And I do want people to be enthusiastic. It's an exciting time, but be mindful about the enthusiasm. And if anything is off, pivot if needed and go to your plan B. Like I said, you get to the clerk's office and the church group is there with 200 people, no problem. You've got your ballot, you're ready. Put your ballot in the ballot box. You can come right in and put it in the ballot box, or you can go to any one of those 4 sites. All right, now, plus C, the contingency plan. Your very best laid plan needs room for something to go wrong. A lot of us have done the poll worker training, and many of us have done poll watch training through other organizations. I did poll watch training. I'm ready. I'm fired up. I'm going to be out at the polls on November 3rd, just as a poll watcher with my cell phone in hand, ready to report if I see anything wrong. If you see anything wrong at the polls, if you don't feel safe, if you don't feel comfortable, like I say, when in doubt, get out. And again, you're prepared. You know what your other options are. You can put that in a ballot box. Take a picture, putting it in the ballot box, FaceTime with friends and family, share with them. But by all means, you got to be safe. Anything goes wrong, call 1-866-OUR-VOTE. That number is manned. I've also tried it myself. It's manned 24 hours a day. The National Bar Association and the Transformative Justice Coalition have set this up to make sure that any activities designed to suppress the vote of our people are thwarted, and they're also prepared to litigate on our behalf. Again, have a plan C and do not mail that ballot. So what do you need for the day of? Your quick day of checklist. You need to have your ballot. If you don't already have a ballot, go onto the city clerk's site, look at a sample ballot, have that already checked off in your mind or checked off in reality. So when you get your actual absentee ballot or your actual ballot on the day of, you're ready to make your choices. In Genesee County, you can vote with a blue or a black pen. I recommend people take a pen with you. There are plenty of pens there, but do you think they're able to actually sanitize each one of those pens after use? So this is your day of checklist. You got your ballot, you got your blue or your black pen. Take your cell phone. Your cell phone will allow you to report anything that goes awry or also share in the experience with others when you're done. Take a snack, just one little snack. Even if you were there for 5 or 6 hours, you will be fine with one small snack, a little bag of nuts, a little granola bar, an apple, a banana, something like that. 1 bottle of water. Why do I say 1 bottle of water? Because even if you were there for 10 hours, you can make it on 1 bottle of water for 10 hours. If you take 4 bottles and you drink them all, you're gonna have to go to the restroom. So just 1 bottle of water, people. This is not Armageddon. We're just trying to exercise that enthusiastic, well-earned constitutional right to vote. Make sure you bring your PPE. If Yvonne lets me, next week, I will demonstrate for you all something very simple called the match test. I will show you that the mask that you're using, a standard disposable mask, a homemade cloth mask, all of those things are more than sufficient to protect others from you and you from others. Have your PPE, have your mask, go with clean hands, have your little bottle of hand sanitizer, and there's plenty of sanitizer at the polls, and you can sanitize when you leave. If you have any kind of mobility issues and you end up defaulting to November 3rd, then you might want to bring a fold-up chair just in case you have to stand outside. I don't think many of us will need that, but if you have mobility issues and you can't stand for 30, 45 minutes, you might want to have a chair. You'll know when you pull up if there's a line outside. So I'm gonna stop there. Plan your vote, vote your plan, and vote love. That's a new hashtag that's been started. Our very own Dr. Mona is in this really great video that was made by will.i.am and Jennifer, what's her name? I can't remember her name, Yvonne. She's a beautiful singer. Anyway, vote love. Check out the hashtag. We have little videos that we've put up. You can check me out on social media at Dr. Deb for Holden. Share this with your friends and family. Make sure you vote. Check your status. Go to vote.org. Plan and prepare in advance. Vote early. November 3rd is not a plan. That's a default. If you want to participate in November 3rd, you can do that as a poll watcher or a source of encouragement for others. And make sure that you support others through this season. We need to come out in record numbers. And my only goal is that we do it, we exercise that constitutional right, and we do it safely. Thanks, Yvonne.
Thank you, Dr. Deborah. Quick question. I think, Billy, you might be able to answer this for us. If a person is in Flint Township and it's in the queue, you can look in there. Can they drop their ballot off at any of the sites that are listed in our webinar? If they live in Flint Township, can they drop it off in a Flint, or should they drop it off at their Flint Township drop-off box? What it says, but it's an outside, and it's bill payments also. Can you respond to that, Billy, openly for everybody?
My understanding is if you live in Flint Township, you have to visit the precincts in Flint Township. We're not one and the same. So,
all right.
And it's a box outside that has a bill payment also. That's the red box I was speaking of earlier. That is not the ballot box. The ballot box is brown. So only brown boxes, and you'll see the voting wording on your box, on the brown box.
Thank you, Billy. Now, Dr. Deborah has given us some really, really detailed information. And remember, when I opened the webinar, I said the intent was that we would bring to you a local focus. And we really want to make sure we're out to vote, but we want to do it with the understanding of the challenges we face with this COVID virus. So the health department is going to come now and give us some even more clarifying information. Suzanne Kupel is here for us today. And Suzanne, I just wanted to be sure that we help our community members know the importance of, as Dr. Deborah was talking, who's around us and how that fits into the importance of even contact tracing in the midst of our voting situation. Suzanne.
So just a reminder to everyone how important it is that you are practicing prevention. And the health department website, which is www.gchd.us, has some documents on it about how to vote safely, how to prepare for voting so that you are safe. But you want to wear your mask. You want to practice social distancing. You want to wash your hands frequently, and if you can't wash your hands, use hand sanitizers. All of those things are critically important. Remember, transmission is by close contact with individuals, and remember that the CDC has said that 15 minutes of contact, and that might be very short sprints of time over an entire day for that 15 minutes of contact. So some of your passing in the hallway or someone that you talk to multiple times in a day, that it adds up to 15 minutes of close contact. So again, ideally not, you don't want to be close to the people that you're in line voting. You want to keep that distance. You want to be practicing the social distancing. When we talk about contact tracing, we are doing case investigation. That means connecting with the individual who's tested positive for COVID-19, getting all the information about their history of health issues, etc., so we can provide them the best information and guidance. But we also, as part of that investigation, ask them who they would have been around during the time that they were contagious. And the health department staff then also reach out to those close contacts. Again, anyone that has been around that person for 15 minutes or more, again, cumulative 15 minutes over a course of 24 hours, so they can be contacted and they can have information shared with them that they've been exposed to someone who's tested positive, the things that they need to do to keep themselves and their loved ones safe, and then all the things that they need to do to protect their own health. This is how we break the chain of transmission, because one person who connects with another could pass on the virus to many, many other people. If we have someone who's tested positive for the virus and we identify all the people that they've been around when they were contagious, and those people either self-isolate if they're sick or quarantine if they're not, then we don't pass the virus on to other people. We don't want that domino effect where one person gets it, pass it on to another group of people who pass it on to other groups of people. That's what we're trying to break. So yes, absolutely, there are ways that we can vote safely. If you want to see a document that will help guide you through that process, check out our website, again, www.gchd.us, and you can get that information and print it off to help guide you as a checklist for your planning process that Dr. Deborah talked about. I do want to remind everybody that as of yesterday, we posted 5,278 positive COVID-19 test results and 302 deaths, with a positivity rate of 6.1%. The number of cases that we are seeing is increasing. Remember again that these numbers that we're reporting are not reflective of all the cases that have likely been in our community, because we did not have a lot of community testing at the beginning of the pandemic. That is not true now. We have many locations in order for you to be tested. The concern that we always have and what we monitor closely when we start to see an increase in that positivity rate is checking every other bit of data to see, is it because we've got a large number of people being tested? And we want to make sure that when that happens, we're monitoring that, but we're also monitoring to make sure that our hospitals are not seeing an increase in hospitalizations and that we're not seeing increases in death. What we've seen since Labor Day is that increase in the number of cases. Now we're starting to see an increase in hospitalizations, and we've seen some increase in death. That is not what we want. We want everyone to practice all those preventive measures. And again, the way that we can keep our economy open is also by practicing those preventive measures. So we've got guidance on our website about voting safely. We have the Halloween holiday coming up. There are some alternative Halloween activities that can keep everyone safe that are posted to our website. But we're also getting into the holiday season where we have Thanksgiving, Christmas, Hanukkah, Kwanzaa, other holidays that people celebrate and generally gather for. And so this is another time of year to start thinking about and planning for your holiday season. And it should look different from other holidays, but you can plan, and you can plan to safely gather with family and friends. Again, I recommend you check out our website with some of the guidance and recommendations about how to carry out that planning process. But start now, talk to your family members, think about Zoom gatherings like Thanksgiving, Christmas. Remember that a lot of the outbreaks that we're seeing now are people moving indoors for things like birthday parties and not practicing social distancing, wearing of masks, and staying with the family members that you are living with, but having new people from outside of your household coming indoors for those types of gatherings. Those are the concerns that we are worried about, the things that we want to plan for as we enter into the holiday season. So I want to also remind you that there's a lot of new guidance that's been issued since the governor's executive orders have been addressed. Remember that the Michigan Department of Health and Human Services has great authority under the Public Health Code to issue guidance and again, wearing a mask, social distancing, all of those things are still in play. But on our website, we have a summary document that lists all of those MDHHS rules that you can take a look at, how many people should be in a gathering, etc. All of that is summarized for you on our website. In addition, there's been new guidance about visiting nursing care facilities. That information is also posted on our website. We have links to the My Safe Start plan. So we want to make sure everyone is mindful about where we are in our process and recognize our numbers are not going in the right direction. And every single one of us can help assist in keeping our economy open, all of our friends and family safe by wearing a mask, social distancing, washing our hands, using a hand sanitizer, and again, washing frequently touched surfaces. So we do have a new testing location in Genesee County, and I want to remind everyone that they are doing PCR tests. That is the gold standard for testing for diagnostic purposes. So all of our sites are doing that. We have the 3 locations that are but for the Hanu sites, which are Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church. We also still have our Hamilton partners doing testing at the North Point Clinic and at the Burton Fire Station at the corner of Bristol and South Saginaw, the 2 Rite Aids at Swartz Creek and on Clara Road in Flint. And there's a new location now, which is the Walgreens on Davison Road in Flint. So all of those locations are available for testing. The pharmacy sites in Hamilton do require an appointment. The sites in the city of Flint for community testing do not, although appointments are encouraged, and everyone can be accommodated. Testing is done at the 3 community sites for adults and for children. Remember, everything has been ADA site visit approved, that there's translation available at all of those locations. And if you have any concerns, you can always call ahead and ask questions. Again, reminding everyone that the health department is open for business. Our Burton Clinic is taking appointments for WIC, family planning, immunization, and sexually transmitted infections. This is also the time of year we encourage everyone to get a flu shot. If you haven't gotten one so far, again, this is the time to get one. We encourage everyone to take care of your physical and mental health. Make sure you get all your health screenings and take good care because we're entering into the fall season. One benefit of all the work we're doing with hand washing is that we are seeing a reduction in foodborne illnesses and other diseases that are transmitted because we're washing our hands. And that's always the best first start in preventing disease in our community. So thanks everyone, and please continue to keep up all of those preventive practices.
Thank you, Suzanne. It's just wonderful that the health department is providing this information. I also want to just share, I went to one of the sites, and I have some other of our panelists who've gone to the sites for this testing at the community locations, and it is the mouth swab. And so you're encouraged to make sure Dr. Reynolds is gone. I know Jim Melanowski is gone, but we encourage you to make sure that you don't eat or drink before you go to these testing sites, because you're going to need a lot of saliva, and that will make sure that they can get the appropriate amount of fluid so they can test you appropriately. And you do get your results really quickly. Got a good turnaround within 48 to 72 hours, those turnarounds. So we must use these testing sites. We're encouraging you. You absolutely must. We don't want to have a benefit of having these sites and then we don't go. So those of you that are on, if you've not been, especially if you're working and you're out and about because you're an essential worker and you're interacting with people, you can get your system in place. And when I mean system, a process. Every couple of weeks, show up at one of the sites, get tested. At this point, there's no cost to us for getting these testing done. So please encourage family, friends, and even yourselves, as you're listening to us today, make that plan to get your test done. Suzanne, did I hear you want to make another comment?
Yeah,
here?
I want to remind everyone, it's not just eating and drinking, but no chewing gum and no tobacco products. Tobacco products is another key thing. You don't want to have anything in your mouth that 30 minutes prior to getting the swab. And just a reminder that the other locations do nasal pharyngeal swabbing or nasal swabbing. So the 3 community sites are doing the saliva test. The other locations are doing either the nasal pharyngeal swab or the nasal swab.
Thank you, Suzanne. Good information. So particularly those of you that are listening to us and you're responsible based upon your area of work to interact with people, communicate with people. These are important messages that we can share. So we're going to share our voice. We're going to make sure we get out and vote. We're going to make sure we do it safely. We're going to share about these testing sites and make sure that we're doing our part to help our community be safe. Now, last week, we had some good information coming from Katie Baxter, and it was so good that we didn't want to minimize the information that she was going to share. So she's agreed, and it has been agreeable every week. Somebody from Genesee Health Systems is in our panelist lineup to answer questions. But today, she's going to finish that conversation. We got your your notes in the webinar pop-up post summary, and you let us know that you want to hear more about this. So Katie's here. Katie, would you bring us up to speed and then keep us moving forward on the things that we need to do, particularly the question about youth and mental health?
Thank you, Yvonne. It's so nice to be with you this afternoon and the rest of the panelists and the group. So I just wanted to talk a little bit, again, remind the group how important mental health is. Our mental health is very important, and we also want to make sure we're taking care of our mental health as well. Last time we talked a little bit about children and some things that ways children have been impacted by the pandemic. And we wanted to continue and talk a little bit more about how do you know when things children are experiencing are more than just the normal challenges we all face. Everybody has a bad day or here or there or feels down a little bit at times, and that's pretty normal. But there are also times that things are more serious than that. And so I wanted to mention, I want us all to be aware of that for our own children and other children we know, how to recognize where there might be a time when a child would need some professional help. And these are some of the things that we can look for. One of them is physical complaints. Our mental health impacts our physical health as well. So when you have children complaining often about some kind of things that are going on, stomach aches or headaches, or they're sleeping more often or something like that, there may be something going on. Of course, we always want to work with our primary care doctor to make sure there's not any medical issues, but sometimes those are the result of not feeling well emotionally, and that can impact our physical health as well. Also, when we isolate, when children are isolating from their peers or from their parents and they're withdrawn, that is a sign that things are not going well for them, and they may be experiencing some kind of depression. So we want to watch for that as well. Grades, when children are normally, let's say they're normally a B student and they do pretty well most of the time, and all of a sudden we see declining grades, there's a indication that something is happening there, and we need to find out what's going on. Also, if we're seeing excessive anxiety or worry or panic attacks, um, anxiety impacts many of us, and especially at this time, it's very difficult. A lot of us have a lot of emotions and anxiety with all the things that are going on in the world. But anxiety is actually very treatable, and we have good treatment for people who experience excessive anxiety. So I would have an eye out for that as well. Also, substance use. Adolescents should not be using substances at all, illicit substances or alcohol at all. The developing adolescent brain, it still has a lot of developing to do, and there's lots of research on how alcohol and drugs can impact that developing brain in a negative way. So we always want to be aware that our children are alcohol and drug and tobacco free. But this also could be a sign that something else is going on, some depression or worry, and they may be self-medicating some mental health symptoms. If a child is experiencing and talking a lot about themselves in negative ways, and they, I can't do anything right, and everything's terrible, and this is kind of an ongoing concern or statements, that can be a concern because there might be something else going on, again, some depression or some significant issue with school. So we want to pay attention to that. I also want to reference the issue about suicide. If ever a child or an adult mentions anything about suicide, we have to take this very seriously. Suicide is preventable, but it is real, and in fact, suicide is the second leading cause of death for individuals ages 10 to 34 years old in the United States, and that is only second to injuries, unintentional injuries. So suicide is a very real problem, and I want people to be aware that suicide has been on the rise across our nation for the last really 10 to 15 years. So it's very important that if you ever hear someone mention thoughts about suicide, that you talk to them and you get them help for that. It's extremely important. So I want to let the group know, I'm very pleased to announce that GHS has a new product line, a new service, and it's called our Virtual Behavioral Health Urgent Care. And this came about through a grant, a SAMHSA grant, to provide support during the pandemic, when many people, first line workers and essential workers, and many people had a lot of fear, anxiety, worries about what was happening, about their family members, about working in the community. And so this was an option. We applied for this grant and received this. And so we have this new virtual behavioral health urgent care. And what it is allow someone to call in. It's our regular number that you've heard me talk about before, 810-257-3740. And that's the same number you call, but you can ask to talk with a counselor and have a virtual counseling center. And we have professionals there to address psychological first aid and as well as crisis issues. So it's a new service that's available, and many people are starting to take us up on this. So we're getting this out to the community. In order to have this service, you do need to have ability to have some kind of virtual interaction like a smartphone or a computer or an iPad or something like that. So, so these are some of the available services that we have for children. I just mentioned our virtual behavioral health urgent care center, and that's for children and adults. We also have what is called intensive children's crisis stabilization. So if a family is having troubles with their child or children and they're feeling kind of at their wits' end and really need help, please reach out to us. We have a variety of services to help families deal with things. And sometimes it may just be one of those days that everything kind of comes to a head and there's a lot of conflict and we need help with that. And families go through those things at times. So it's okay to reach out for help. We also have many other crisis services that we can authorize, including inpatient services for children if that is needed. We also have family support coordination. This is a program that was designed to address the needs of children impacted by the Flint water crisis. So there are many services and resources that a case manager can link, or a navigator can link a family or a child to, including our own NCE, our Neurodevelopmental Center of Excellence, where we do neuropsych testing for children impacted by the water. So these are all resources for children that we have available. We also have many evidence-based practices. I've noted a couple on the sides here, like TFCBT and DBT, Families Moving Forward, but there's many others. So we have a whole array of services for children as well as adults. So I would encourage you to contact us if you're having a mental health or substance use disorder need. These are some of the numbers you can contact us at. The number on the bottom is our main number, 810-257-3740. That is not only our crisis line number, but that's also our access line if you are just calling for routine services. We also have other numbers that are specific to the water crisis, and that number is 810-257-3777. Our general customer services number is during business hours between 8 a.m. and 5 p.m. That is 810-257-3705. And our Genesee Community Health Center, our FQHC, or our primary care center, that number is 810-496-5777. So please reach out if you are in need, you or a family member are in need, because we are here to help you and help the community. And we want to support good mental health and hope and health and recovery in the community. Thank you.
Thank you, Katie. Now stay right with me because you've provided some great information, but we have some questions for you. First question, and I was jotting a question myself, and we're going to ask our participants to put questions in, and I'll read a couple of them here. Katie, you talked about the challenge with children, and I was going to ask you to clarify what questions can a parent ask if they're seeing these symptoms in children, but they're not really able to elicit or get from the child those questions. And then we had one of our participants say, sometimes toddlers, younger children seem to be experiencing anxiety as well due to these changes. And so how do we communicate with these little ones?
Well, what I would say, first of all, is for children who are older and that have verbal ability to talk with us, it's important just to talk to our children and to pick a good time to talk with them and ask them how they're doing. Open-ended questions. What's going on at school? What's going on with your friends? How are you doing at home? How's your homework? How are you feeling about what's going on? So just talk with children. I think that's really important. And if we pick a good time, sometimes if we're driving in the car, there's different times that kids might be willing to open up a little more. That's wise to do. As far as little children, they can't communicate in the same way, of course,
right,
as older children, but we can see signs and concerns with them. And we need to watch that closely. We work with our pediatricians, and that's one of the front lines, that if you have a child that you're not sure if your infant or child is developing normally, talk with your pediatrician. And pediatricians often will make referrals for mental health services when they think it's not a physical issue and it might be a mental health issue as well. So keep that in mind. So I also just want to say it's so important not to give children too much adult information. We have a lot of worries and things we're concerned about, and those are adult problems. Those are not children's problems. So we need to shield children from that and protect them. So we want to keep them, basic information about challenges or struggles that are going on, but keep it to a minimum and mostly allow them to do things that they need to do, their homework and fun things and things like that.
So we're going to do a combination of actually observing and then talking with the children as well. Now, Katie, you mentioned these programs. A couple of questions in the queue is, are these grant only? Are they Medicaid? Are those persons, if they're Medicaid eligible? And, what is the insurance requirement?
Well, we have programs for everyone. So I encourage you to reach out and contact us. We are mostly Medicaid funded at Genesee Health System. However, we do have other grant programs for people who do not have Medicaid. So I encourage you to reach out. We can let you know what you would be eligible for and what services we can provide to you.
Thank you, Katie. So I often tell people, don't assume, don't sit and wonder, make that phone call. We have these numbers available for you. Make that phone call. And last question here is the crisis hotline available 24/7?
Yes, it is. 24 hours a day, 7 days a week, 365 days of the year. Yes, we are always here for you.
Thank you. Thank you. And again, one last question. Will GHS offer mental health first aid training in the near future?
Yes, I believe we're working on that. During the pandemic, training has been very different than it used to be. So I believe our training department is working on rolling out many virtual trainings. And I think mental health first aid is one of them. However, this is a pretty involved training that is more than 1 day training. So they are working on that. So stay tuned. And that's a good question for customer services, our customer service line. But yes, we're working on that.
Thank you. Now, Katie's going to stay with us. And again, there are other panelists in the queue. You can talk about health and health coverage and the benefits thereof. You can get those questions in the queue, and our panelists will be happy to answer those for you. So thank you so much, Katie. And we'll look forward to you coming back with some more details about what GHS is doing regarding mental health. Now, thank you for putting those questions in. Gary Jones is always here. Gary, we appreciate you bringing us information out of the governor's office. Can you give us what's on the horizon right now out of the governor's office, Gary?
Oh, yep, absolutely. I'm actually on the road right now, so forgive me. Had to pull over real quick to get through this. So, can you hear me just fine?
I got you now. Yeah, you were breaking up a little bit, but we hear you.
Yvonne, are you still there?
Yes.
Okay, all right. If for whatever reason, if you can't, hear me, just let me know. I'll see what I can do. But just a couple of things. So total confirmed cases for COVID-19 are now at 152,862 statewide. Total COVID-19 related deaths are 7,120 cases as of October 17th, are 109,539. And as a reminder to everyone, that recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, the governor signed bipartisan bills to protect workers and businesses that do their part to protect Michiganders from COVID-19. So the governor signed these bipartisan bills protecting Michigan workers from the spread of COVID-19, as well as protecting businesses that implement strict safety measures to keep workers, customers, and their families safe. The governor also recently announced a $1 million investment to contact 1 million Michiganders and help those who may have lost health insurance in 2020 get the coverage that they're looking for. So the governor made this announcement that the state is going to invest $1 million to contact these 1 million Michiganders to help those who may have lost health insurance during the COVID-19 pandemic get covered. There are a number of ways for people to get either no or low cost health insurance, and this investment will help raise awareness and increase access to those programs. Also recently, as it was stated earlier, Michigan Department of Health and Human Services issued an epidemic order, which basically has some of the same guidelines as the governor's previous executive orders. But there was a one-pager that they published. I do believe Susan mentioned that it's on the Genesee County Health Department's website, but there's also a link to it as well. And I can definitely, send that link out if anyone is interested. I believe my contact information is up on the screen, but you can email me at jonesg9@michigan.gov. And I can forward that one pager out, for you. And it just clarifies in a very brief fashion what's entailed and or what's inside of the epidemic order, I should say. And as a reminder to everyone, michigan.gov/coronavirus is still the best website to keep updated with everything.
Thank you so much, Gary. And I just want to remind our listeners that you can call Gary if you need. He's giving his phone number out. You can see it on the screen. But for those of you that are listening in or on YouTube, it's 517-282-3193 to ask him any questions or get information, or you can email him and get on his email listserv. He sends out information daily at Jones, JONESG 9@Michigan.gov, Jones G9@Michigan.gov. Thank you so much, Gary, and appreciate you pulling over to share that information with us. We've talked today, and you've heard the numbers from our county health department, and you've heard the numbers from the state. Our numbers are going the wrong way. We are doing this webinar to ensure that we have the information that we need. So I want to just remind us that it is important for us to maintain health and personal protection during COVID and the reopening, because things have been reopening. Some of the schools have been reopened, but we heard earlier that some of those schools are now having to close. Dr. Reynolds' mission, even the University of Michigan, having to quarantine some of their students as a result of an outbreak or in that particular area. So we want to encourage you, maintain the hand washing. This is one of the best practices. We learned this, most of us, when we were in kindergarten, and our parents tell us, wash your hands. We're telling our children that all the time. So we want to maintain these practices, using the personal protection equipment, practicing social distancing, and boosting our immune system. I know sometimes, eating some salads and fresh fruits and vegetables may not be as easy because we're busy. Still, in the midst of Corona, we're busy, but let's be sure we're doing what we can to boost our immune system, because as was said to us earlier, right now, there is no cure. There's no magic bullet right now, and I don't know if there ever will be, but we can do what we can do to make sure our bodies are our best defense mechanism now in this situation. Regularly clean the touch surfaces, hand sanitizers and the wipes. Let's clean our surfaces. And I was told, my sister works in a laboratory. She says you need to mix it up sometimes. Wash your counters down or those surfaces that you use often with bleach, and then switch up and use the Lysol. But make sure that you're cleaning those surfaces regularly. We encourage you, please use these testing sites to get tested. And we'll be going over these every day. I've got a couple of other announcements I want to get to right quick before we have to leave so we can move forward. We've got some events coming up. We want to remind you that you can join the Fall for Fitness. You still have until October 31. So we have a week to go. So join the Greater Flint Health Coalition's Fall Fitness. Another event that's going to be coming up is the Flint Community, the Healthy Flint Research Coordinating Center annual symposium. That symposium is going to be coming up in November, but you'll have an opportunity to go on the Healthy Flint Research Coordinating Center site, look up that symposium, because we are looking for people to join us and to nominate people about this. So go on our website, and we'll talk about it more next week. But I just wanted to make sure you knew that opportunities was there. We are providing the CEUs. So if you are in need, community health workers particularly, of those CEUs, please let us know, because those are available, 1 credit for each one of the webinars that you attend. Following this webinar, you're going to get a quick 1-minute evaluation. We need you to complete that pop-up evaluation, because you give us important information that helps us to move this forward. As a result of your input, we've got some great things that are coming up to respond to some of the questions that you have answered. We want you to join us next week. We're going to be here October 30th. Yes, just before that day when we're going to give out all the candy. We want you to join us, though, next Friday, right here at the same place. Please share. Please share with others. I want to make sure, go to www.hfacc.org and nominate someone for that research symposium that will be held on November 20th. I want to thank you for joining us today for the 32nd Healthy Flint Research Coordinating Center's Flint Community Webinar on Coronavirus. Thank you for joining us, and we'll look forward to seeing you again next week.